thanks for tuning in today. Today we're going to do a Q&A with my good friend Aliza.
Hello!
And for those of you who don't know, I'm a pregnancy chiropractor and treat babies as well. And so we've asked you guys questions and we're gonna try and answer them as good as we can. And Aliza, why don't you tell us what it is that you do?
So I'm a midwife in Hong Kong and in Australia, and I'm a perinatal mental health specialist and the creator of Bumpnbub as well. So I asked you guys as well, and we got loads of awesome questions, so we will dive in.
Yeah.
Okay.
Let's begin.
So the first question is, do you recommend that every woman sees a chiropractor?
Yeah. So, good question. I believe in, so everyone is a little bit different. I believe in wellness. I believe in optimizing your health, not so much symptom treating. So that's where I'm a little bit different.
Yeah.
So yeah, definitely get an adjustment or just have an examination done, see if there's anything out of alignment, especially if you're thinking about having kids.
Yeah.
Because if you have any imbalance in your spine, which most of us does, most people have a short leg or a pelvis that is a little bit out of whack, or we sit in an office like bad posture.
Yeah.
So most of us have, or boobs, which
Heavy
can also give a little bit of tension in the middle back. So there can be lots of reasons, or walking in heels to work, that kind of stuff. Like little things can just make you a little bit out of alignment, and yeah, you just feel so much better when you get everything adjusted. So,
100%.
and when you become pregnant, if that's in your plans, if you have a little misalignment, it always gets a little bit accentuated when you have the belly pushing you forward. So yeah, always a good idea to see a chiropractor. You don't need to be in pain. Just get it checked.
So the next question is, can a chiropractor turn a breech baby?
Yes. Okay, so that one I get a lot. So as a pregnancy chiropractor, so what we don't do is we don't grab the baby and turn. This is something you do in a hospital with an ultrasound and local anesthesia, okay? Yeah. So that's a different kind of turning of a breech baby.
That's called an ECV.
Yes, ECV. So that's a different option, which is what we do if it doesn't work. So we try chiropractic first, and we use something called Webster's technique. So basically, it's an analysis of the sacrum, which is the lower bone. Should actually bring it in a second. This one. So we analyze the position of the sacrum. So this is your pelvic here. This is the sacrum, this bone here. So we analyze how the position is here and in the pelvic bones, which consist of 3 bones here, 1, 2, and the symphysis pubis on the front. So we analyze that, see if anything is out, and then what we do is we adjust any misalignment, and then we also go in and we look at the annular ligament. So that's the Webster technique. And when you do this, you can even do it proactively throughout pregnancy, then the risk of breech gets even less.
Yeah.
But I've had for the last 10 years about 3 cases where no matter how much manipulation we did, nothing happened, and it turned out the baby had the cord around the neck and one had a leg like stuck in the pelvic. So if they don't turn, there's always a reason. Okay? These babies are clever. So no forcing, but you can totally do non-invasive manipulation, and most of the time they do turn because we do create more space in the pelvic. So it's all about creating the space for them to naturally move around.
Yeah, that's so cool to hear, because I think most people think there's 2 options: have an elective cesarean or do an ECV, which people know can be quite painful and is frightening for a lot of people. So that's awesome. Okay, the next question is, how did you meet in Hong Kong? So I run Bumpnbub, as you guys know, and one day in one of my news feeds, Camila popped up, and I saw that she did pregnancy and baby chiropractics, and I was so intrigued. So I sent her a message and asked to meet up for coffee, which I never would have done 6 months ago or living in Australia, but Hong Kong is like a small world for expats and pregnancy and birth and all of that kind of thing. So everyone kind of knows each other in this industry, so it's awesome.
And like social media is such a good way. It's not, I found that the last couple of years.
Yeah.
It's you can meet really good friends on Instagram. Like,
how cool, right?
Yeah, super cool.
So the next one is, how do I find a chiro that is actually qualified to do prenatal work?
Yes. So that's a very good question as well. Also, there's so many chiropractic universities around the world. They all have their different schools, and what they learn is different. And but what I was just talking about before, the Webster technique. So you can always, first of all, word of mouth. Ask your friends, who are they seeing, who are they happy to see? Always a good idea. Second of all, if you call and book appointment, always ask, is the chiropractor using Webster's technique? If they go, what? Don't see them. Okay? So Webster's technique is a specific prenatal certification that you do when you're a chiropractor. Or you can just train. So I trained with a mentor for 4 years. So I literally learned by doing. He had 6 kids. So that's how I learned, just by doing and just copying and just getting my hands in there. So there's so many different universities and degrees, but just ask if they do Webster's technique. Okay?
Awesome. Is there any actual clicking or just manipulation of joints for babies?
Yes, so that's a good question. So most of the time I will see the mom throughout pregnancy, and then after birth I see the baby. Yeah. And they always ask, oh, is it the same? Are you gonna crack the baby? And the answer is no, I do not crack the baby at all. Very gentle. And I use this little thing, so it sounds like a click. It's called an activator. You can hear like that. So what it does is make a little impulse instead of the cracking, because it's a baby, we don't need to do that. We just do a little impulse like this to activate the little nerves in the system after birth. So so no
cracking
manipulation, just a bit of clicking and some massage.
Yeah. Nice. Okay. The best way to burp a baby after a feed. So we don't have a doll, but a way that I find really good is to put baby's bottom on your leg, hold baby upright, kind of stretch their back and their chest upright, and kind of just bob your knee a little bit and rub them. So you're basically trying to open up this whole area for air to come up and out. When they're very little and newborn, putting them on your shoulder, they often curl up like little fetus as they have just come out of the womb. So they kind of curl up and it's hard to get their back straight. But as they're older, you can definitely put them up on their back. But yeah, definitely like this to start with.
And do you find, I just thought about this the other day, babies are so cute when they burp. If it's a grown-up, it's like gross. And the baby's like, oh my god, you're so cute. You're
so clever, look at you. 100%. So why do babies actually need to see a chiropractor?
Okay, so most of the time it's after natural birth. So through the birth canal, which is a bit tight usually first time around, and sometimes they get stuck in the pelvic here, this bone going down here. So head down for a long time, long duration of labor can create some birth trauma, and they say it's up to 70% of all babies who have a little bit of a birth trauma, whether it's the neck or the lower back. Can also be twins that usually have less space as well.
Weird positions.
But even after cesarean, there's a lot of cesareans here. So even after cesarean, sometimes when it's an emergency C-section, it has to happen fast, and it's not gentle. They pull out the baby quite hard, and that can.
It's life-saving.
Yeah, it is. So you gotta just do it fast. Yeah. So about 70% has a bit of birth trauma. Usually babies respond quite well, so they don't need a lot of treatment. But just to be straightened out after birth, after they've been this for a while, is always a good idea.
As a midwife, would you recommend a chiropractor? Definitely. I think since also I've met Camila, my eyes have kind of opened a little bit as well to how, just exactly what we were saying, 70% of all babies have some kind of birth trauma, whereas before I would normally only say it to patients who had a ventouse, so the vacuum cup on baby's head, or a forceps, just because if you've seen one, you can see how jarred their necks get, and it's quite a rough process sometimes when it's life-saving. So I would always say to those mums, try and take your baby to a chiropractor, but now I would 100% tell every mum to take their baby to a chiropractor. Absolutely. Okay, so was it hard becoming a midwife and a chiro?
Oh my god.
I was going to say the same thing. Oh my god. Yes.
I don't want to discourage because I know there's a lot of students watching it. I don't know, I was an athlete before, so I kind of like challenges. So I literally looked up what is the most difficult education to enter, and I was like, oh, chiropractic.
That.
Yeah, just for the fun. It's like a game for me.
Yeah.
So yeah, I applied and had to fly in from London and do multiple choices and like an interview and all this stuff. But it just made it more fun to try and see if you could get accepted. Because where I'm from in Denmark, it's a very small, we don't have a lot of spots for chiropractors because we study together with it's basically medical school and chiropractic in the same school. So we study together for 3 years, and there's a very limited seats for Danish people because we share it with all the other Scandinavian countries. So yeah, it was like extra hard to get into chiropractic. I was quite shocked. When I got the letter, I was like, oh, okay, we'll try it. Yeah, try it out. Yeah. And then that's when the real hard stuff started. I would say the first 3 years, because it was medical school plus extra courses on top, I literally had no life.
Yeah.
But it's so worth it now. And then the master is 2 years, and that was a little bit better because it was more specialized. It got more fun, more clinical stuff, more patients, all that kind of stuff. So yeah, the master was better. So then that's already 5 years. Then you had 1 year where you had to be in a private clinic with another chiro, and they had to like give you all these check. So it's like 6 years. So yeah, not easy, but also if you're passionate about what you study, it's gonna go like this, and you're gonna miss it. Yeah. So totally worth it.
Yeah. So midwifery wise is not that long, but it was also hard. So I was 17 when I went into university. So I was always young for my year. So I was definitely the youngest by a lot in my course, which was a bit of a challenge. And then also, you know, walking into a room and saying, I'm going to deliver your baby. Yes, I'm 18 now. But, you know, that was challenging. But the midwifery course itself was amazing. So it's 3 years full time if you do a Bachelor of Midwifery. So I studied in Sydney. And we have to follow 20 or 30 women from conception until 2 weeks after birth. So that was phenomenal. Like, you make such good relationships. I still hear about, you know, their 2nd and 3rd birth, 4th, 5th birthdays. It's awesome. But it's challenging. So you're basically on call for 3 years of your life.
Oh, wow.
So, you know, someone will go into labor at 30 weeks and there goes your weekend plans, or, you know. So it's challenging, but it was also awesome. And then I did a 1 year course to do a postgraduate degree in perinatal mental health, which was great, but again, very challenging.
Can you actually tell me more about that? The what is that? Yeah, perinatal. So
it's mental health issues from pregnancy until up to 1 year after birth.
That's interesting.
So like pregnancy and postnatal depression, OCD, anxiety, psychosis, all of that kind of stuff.
Because people are so focused on the postnatal depression, not so much
the pregnancy.
I find on Instagram anyway. It's all about postnatal and depression, but like during pregnancy, that's also a challenging time. So that's 100%. Really cool if you can.
100%. And you know, even people that have wanted their babies for so long, or they often, you know, mental health issues can kick in and can kind of grab hold of anyone. And I think that's the hard thing, because we don't talk. Postnatal depression we kind of all know about, but we don't talk about exactly what you were saying, like antenatal depression, all those kind of things, and also psychosis, which is a very hectic one. Do you know much about psychosis?
Oh, I used to work in the psychiatric ward during school. So yeah, with like an alarm button if someone attacked you. So it was all kinds of schizophrenic and like suicide attempts and. But psychosis as well. I remember but that was like guys and stuff. You had to stay away because they could get a bit violent. But it's like a different person.
It's a completely different person. I know, it's terrible.
It's a bit scary.
It is. I want to make a whole separate video on that.
Good idea.
All right, the next question is, how do you help a baby with colic? Do you want to go first?
Yeah.
Do you want me to go
Yeah. So how I help as a chiropractor, I will go in. So a lot of babies have it, especially first time around.
1 in 5.
Yeah. And they can be fine, and then all of a sudden they just start like screaming, and no matter what you do, you can't settle them, especially when they're on their back, so it's literally just gas in the stomach. Also when they induce or just epidural, all the drugs that they use during labor can
Go into
cause
baby
colic
system.
in the baby. So a lot of women comes in with colicky babies.
Yeah.
And what I do for them is not only do I open up the spine around like the lower back and sacrum where the nerves go to the intestine, I also do massage of the abdomen. And you can actually check out one of my videos where I show how you can do a baby massage at home, because that works wonders. And then use the legs. You can, like, we should have a baby.
I know.
Show.
Use the legs, like rotate the legs gently, not the hips, but just like moving the.
Like press out the farts.
Yeah, exactly.
Like
helps move that. Even if they're screaming, just try and do it for a minute or two. I see that as well. Yeah.
But also, I find that if you try and get less air in.
Yeah.
When you're feeding the baby, then there's less air for them to have to get rid of. So that's pretty important to instruct, but you can talk about that.
Yeah.
But yeah, I just do massage, and then I do foot massage, like reflexology.
Oh, really?
Yeah, because that can also just activate the
So
whole
cool.
system. Yeah. But I usually teach the patients to do it themselves at home.
Can do it at home,
so they can do every day. Yeah, that works good.
Yeah.
And then I prescribe infant probiotics just to help out, and also the mom, both baby and mom, just to help
the gut flora.
Get it going, get it going.
So my kind of suggestions would be, so everything that Camila said, as well as, so if you're breastfeeding, sometimes it's worth looking at your diet. So a lot of babies have become really gassy and unhappy from mom eating, say, garlic and onions is like two of the main kind of trigger ones. If you're formula feeding, it might be worth looking at a low allergenic one, or one for more sensitive stomachs, an organic one. It's definitely worth kind of exploring. There's so many formulas out there. So if baby's not reacting well to it, that's probably one of the first things you could do. Warm bath, so hot water over baby's tummy helps to settle it, the same as us. I mean, we get into a hot bath and our stomach pains disappear. So same works with baby. Swaddling, so tight swaddling really helps as well. So when babies have a reflex called the startle reflex, where they throw their hands up and they scare themselves. So often when they're crying and in pain and they're startling themselves, it just gets worse and worse and worse and worse and worse, which obviously triggers their pain as well, because when they're stressed, their pain's worse. So if you swaddle them, you keep them warm, and you're kind of just keeping them close to you as well is another good one. Baby massage, and then if those kind of things don't work, I mean, if you're ever worried, definitely go to a pediatrician, 100%. But often a pediatrician will also say gripe water. What do you think of gripe water? Do you have much experience with that? Not really. So gripe water is something that our lactation consultants back in Australia often tell mums to give their babies, and it does work well. But like you said as well, with the less air in, less air needs to come out. So when you're breastfeeding, make sure there's a really good attachment. After you finish one breast, hold baby up, burp baby, and then go to the other side. Same with bottle feeding. Make sure that when you're feeding, baby's not sucking in air, so the teat should always be full of milk. And so if you're holding it like that, there's obviously half air, half milk. So you're making sure there's all milk and there's less air going into baby. And the same, so burp halfway through a bottle and then keep feeding.
And when you mix the bottle, not like
just
gently,
not too
bubbles.
Much air in there. Yeah. Okay, the next question is,
we have more.
How long does it take to study?
So for me it took 3 years bachelor, 2 years master, and then 1 year in private practice, so that I earned my right to go international and practice, so which is what I'm doing now in Hong Kong. Otherwise I wouldn't have been able to be here.
Yes.
So 6 years.
Cool. And I think I already answered it as well, but 3 years midwifery, 1 year perinatal mental health. So next, what country did you study in? We've kind of covered that as well. But
Denmark.
I trained in Sydney in Australia.
I was so lucky though, because I actually lived in England, and they have a chiropractic college, and someone offered to pay it for me, and I was like, you know what, I'm just gonna go back home and be with my family. And they have such a great, they pay for the students to study, so you don't get a huge student loan. So when you're finished, you don't have to start by paying off a loan. Like mentally, that is so nice. You can just, So I decided to go back home and study, and it was amazing. Yeah.
Nice. Okay. At birth, who actually delivers the baby? So it depends what country you're in, and it depends what model of care you go into. In Hong Kong, primarily obstetricians in private practice hospitals. In Australia, both public and private, it really, really, really differs. Ideally midwives, says me, who is very biased. So midwives kind of look after low-risk women and low-risk babies, and doctors and obstetricians come in for high-risk babies, or babies that an emergency case has unfolded. So in Australia, our delivery ward, there'll be, say, 10 midwives. Every woman comes in, every woman's assigned a midwife, and unless that woman becomes high risk or unless she has a private obstetrician, a midwife will deliver her baby. So we deliver the babies unless we need the help of a doctor or unless she's paying someone privately to come in at the very end and pick the baby up.
Same in Denmark. So midwife is like...
Yeah. So could a woman have adjustments during labor?
Yeah, it could relieve, but that again, in Hong Kong, they're very restrictive about who gets into the ward. Sometimes they can only have one practitioner there, and you have to choose, or your husband. So it's very restricted here.
Yeah.
In Denmark, we have home births, water birth, all that, and you can have whoever you want to relieve your pain. And as we know, pain from uterus, pain from all this can go and refer to our lower backs, so it definitely helps getting adjusted, massaging, reflexology, anything to relieve the pain of a laboring woman. So, 100%. But it depends on your country and the rules in that country.
Yeah. All right, that's the end of our questions. But thank you so much, and it's been awesome. Thank you.
Remember to like and subscribe to the
thank
channel, and if you have any further questions, you can always comment below, and we'll try and get back to you as soon as we can.
Sounds good.
Thanks for tuning in. Bye.